Welcome. My name is Dr. Sujit Iyer, Director of Pediatric ED Outreach for Dell Children's Medical Center. Today, we'll be reviewing the indications, tips on preparation, and tips on delivery of intranasal medications for young children in the emergency room. For more videos and clinical tips, please subscribe to our YouTube page below. And for any other questions, you can always reach out to us directly by email. Let's get started. At Dell Children's Medical Center, we use intranasal fentanyl and midazolam for its ease and convenience. Intranasal delivery of medication allows for rapid absorption across the blood-brain barrier, and onset of action can be seen as fast as 5 minutes. Intranasal fentanyl is as effective as IV morphine and much faster. Intranasal midazolam has very strong anxiolytic and amnestic properties, but it should be noted by itself does not provide any analgesia. Numerous studies have now shown both the safety and effectiveness of intranasal fentanyl and midazolam in the pre-hospital and hospital setting. Seton policy is that the use of intranasal fentanyl and or midazolam is not considered procedural sedation. We do recommend the same level of monitoring as when delivering a narcotic, which in the case of children is a pulse oximeter. Nasal irritation and bad taste, specifically with midazolam, are the most common side effects. Contraindications include nasal trauma, significant obstruction, or a known adverse reaction to either medication. In preparation of delivering intranasal medication, here are some common tips. Make sure to have a pulse oximeter in place before delivery of these medications. We recommend calling your provider as onset of action can vary in young children. Drawing up medications from a glass ampule always requires a filter needle. We recommend drawing up an additional 0.1 ml of medication to allow for priming of the atomizer. We do not recommend using saline to increase the volume. Lastly, as a standard, we recommend always checking the dose of medication in the atomizer, as well as performing a double check with another provider. Before delivering intranasal medication, here's some important tips. There is a strict 1 milliliter limit of medication per nair. If your total volume exceeds 2 milliliters, administer the second dose 5 minutes after the first. If using both intranasal midazolam and fentanyl, remember that the effects of midazolam last a bit longer than fentanyl. You can deliver these medications simultaneously if you are not exceeding the maximum dose per nostril. When delivering the medications, have your child tilt their head backwards to avoid dripping of the medication. If the child has a runny nose, try and have them blow the nose prior to the delivery of medication. And lastly, have a sweet juice or Serpalta available after medication administration, as the taste of intranasal midazolam can be a bit noxious. In preparation for this, you will need a 1 or 3 ml syringe, an atomizer, and the medication. Keep in mind that you will also need a filter needle if drawing medication from a glass ampule. Always drop the correct dose of medication in the syringe before completing a nurse double check. The recommended doses are listed here. Remember, there's a strict limit of 1 milliliter of medication per nair. If your total volume of medication exceeds 2 milliliters, you will need to wait 5 minutes after the first dose to complete the delivery of medication. Once you have performed your nurse double check, labeled medications, and have your equipment ready, you are ready to attach the atomizer. Make sure to have one atomizer per medication. Open up your atomizer and make sure to secure to the top of the syringe. Keep in mind that you will need an additional 0.1 ml of medications to prime the atomizer. We do not recommend using saline and recommend using an additional 0.1 ml of medication. Here, you can see the priming of the atomizer in a 1 ml syringe. Prior to the delivery of intranasal medications, make sure to have a pulse oximeter in place. As you can see here, we also recommend the use of topical anesthetics like Let gel that you can see here placed with the tegaderm on the forehead. Distracting items appropriate for the child's development will also help with the procedure. Further information on this can be seen with the supporting material. Prior to delivering medications, make sure to have the head of the bed at 45 degrees and pulse oximeter in place. You will often need a partner for delivery of medications in young children. Place the atomizer loosely into the nostril, aim for the center of the nose, and quickly deliver medication. there is a noxious taste, especially to intranasal midazolam. As such, you can quickly have the parent comfort the child and deliver sorbitol or juice to remove the noxious taste. As you can see here, the patient is quickly comfortable after the delivery of medications with both distracting items and some juice. Young children will generally be less anxious and more comfortable with the environment after delivery of medications. In young children, it will also still be helpful to have distracting items as well as parents to help with holding. As you can see in this case, the patient has also received let gel for topical anesthesia and is tolerating the procedure quite well considering the stage of development. In older children, you may need less distracting items as well as less people to hold. As you can see in this 20-month-old, intranasal medications make it quite easy to perform this procedure simply with an assistant as well as the mother at the bedside. Thank you for taking the time to learn more about using intranasal medication in children. We hope that you can incorporate this into your own practice. For more information or any further questions, please contact the educational team here at Dell Children's Medical Center. We thank you for your time, and please click on any of the videos below for more tips on pediatric care in the emergency department.